Do you like setting your own money on fire? Because I don't. And if you're paying the full price for these 12 things and you're on Medicare, then that's exactly what you're doing. You may as well be taking all your money and throwing it into a dumpster and lighting a match. It kills me to see that so many people are paying full price for things that are already 100% covered in their Medicare plan. And today I'm going to tell you about 12 things that are surprising that so many people don't realize Medicare actually covers. Let's quickly go over these 12 things now, and I've saved one of the best benefits for last, so be sure to stick around to the end. Number one is wheelchairs and scooters. I'm talking both about the manual wheelchair and the electric scooter. As you age, falling is probably the highest risk thing that can happen to you. So Medicare covers only, of course, medically necessary equipment, but it covers wheelchairs and scooters for people who are at risk of fall or who have mobility issues. Now, in order to get a wheelchair or a scooter, your doctor will need to prescribe to you a wheelchair or scooter for use at home. You must have a face-to-face examination with a prescription from the treatment provider, meaning your doctor, before Medicare is going to cover a power wheelchair or a scooter. The cost for you will be your Medicare Part B deductible and your 20% coinsurance. Unless, of course, you have a Medicare supplement or some other plan, then the cost could be reduced. So if you're in a situation where you have mobility concerns, see your doctor. They can help you by prescribing this and helping you get a wheelchair or electric scooter. Number two is both chiropractic and acupuncture services. A lot of people don't realize that you can see a chiropractor or receive acupuncture using Medicare. This may surprise some people because a lot of people think that Medicare only covers traditional Western healthcare. However, there are people who can use chiropractors and acupuncture to help them manage chronic pain. Here's what Medicare covers. Medicare covers chiropractic services for manual manipulation of the spine to correct subluxation. Yeah, I memorized that. Subluxation means that your joints are out of whack, they're not in the right place. Manipulation, the doctor needs to move them around, so think of it like an adjustment at your chiropractor's office. If you have chronic pain or you have back pain, then your chiropractor can bill Medicare for manipulation of the spine, meaning for an adjustment. Now, a lot of chiropractors offer a lot of other services like, the beautiful bed that you lay on and it's got the water that massages your back. I love those. Things like that are not going to be covered by Medicare. Medicare is going to cover the adjustment. Now, for acupuncture, that is available for people with chronic low back pain. Now, if you've had chronic low back pain for 12 months or longer and don't have an identifiable cause, and it's not related, as Medicare says, to pregnancy or surgery, not very many people on Medicare have to worry about pregnancy, but remember that you can receive Medicare through disability. So we laugh about that, but there are people on Medicare that do have pregnancy. So if it's not related to pregnancy or surgery, then you may consider acupuncture. What Medicare covers is 12 visits within a 90-day period, and then 8 more days if you are showing signs of improvement. And the cost will be your Medicare Part B deductible plus a 20% coinsurance, unless you have other insurance like a supplement or a Medicare Advantage plan, which in those cases, the cost may be as low as zero, but it depends on your plan. Number three, support for weight management. If your BMI is 30 or higher, then you qualify for free services to help improve your overall health. And this surprising benefits helps many Medicare members live longer and healthier lives. But a lot of people don't know about it. So people with a body mass index above 30 or more, they are covered for what is called an obesity screening. Now, there's behavioral counseling, where Medicare covers the counseling if your primary care doctor or other primary care practitioner gives the counseling in a primary care setting, meaning a doctor's office, and they can help coordinate with other doctors to help you get what you need without any extra hurdles. So in addition to behavioral counseling, that may include nutritional counseling that can help you to manage your weight and to put together a plan. Now, what Medicare does not cover, however, is that Medicare does not cover weight loss drugs for weight loss alone. I'm talking about the very popular drugs like Ozempic or Wegovy. They need to be prescribed for another medical reason. So if you have diabetes or heart disease or something, and you also have weight gain or you're overweight, then you may qualify for Ozempic and Wegovy, and Medicare will cover them under Medicare Part D. The cost for obesity screening is zero. There is no cost. So for people struggling with obesity, Medicare covers those screenings and the counseling, and it can provide valuable support and help you in your weight loss journey. Number four is alcohol and smoking counseling. If you're one of the people who is smoking or consuming alcohol and wants to quit, here's what Medicare covers to help you. If your doctor determines that you're misusing alcohol, you can have 4 free face-to-face counseling sessions. Or if you're smoking and you want to quit, you can have 8 counseling sessions every year. Now, the 4 alcohol and the 8 smoking sessions, counseling sessions for each of those are annually. The cost is zero. There is no cost to you with Medicare to get those counseling sessions. You just need your doctor to help you to get them. Now, if you've never tried it before, counseling can be a powerful first step towards quitting, because not only will you get valuable guidance, but it also reinforces your commitment to making that change. Number 5 is preventive services. If you had known my grandpa, and probably your grandpa said this too, an ounce of prevention is worth a pound of cure, right? So Medicare agrees. Medicare covers a long list of preventive services and preventive screenings. Medicare covers things like diabetes screenings, glaucoma screenings, HIV screenings, cancer screenings like mammograms, prostate cancer, cervical cancer. So all of these preventive services for Medicare are covered at zero cost. You don't have to pay for any of these things. In some cases, you just need your doctor to say that you need to have that screening done. The goal is to diagnose disease early because that drastically increases your chances of curing it. So if you have Medicare, there's just no excuse to not get checkups. Number 6, and this is a new one for 2025, caregiver training. So think about this. If you're in a situation where someone needs to provide care to you, or you're providing care to someone else, sometimes, you look at spouses as they age, sometimes one of the spouses is providing care to the other spouse, and it is taxing. Now, this is new for 2025, and it can be so helpful for people who are struggling to find a good caregiver for themselves or are providing care to someone else. Here's what Medicare does. It provides caregiver training to help caregivers learn and develop the necessary skills such as how to deliver medications, how to provide personalized care, and more things like that. Note that Medicare only covers caregiver training if your doctor or healthcare professional says that caregiver training is appropriate for your treatment plan or the treatment plan of the person that you're providing care to. And if you're providing care to someone else, they must be present when you're receiving caregiver training. And the same is true if you're receiving the care, then the person giving the care must be present when they receive their caregiver training. Now, the cost is your Part B deductible and 20% coinsurance. In other words, it's Medicare Part B. As with the other costs I've talked about today, it also depends on what insurance you have. If you have a Medicare supplement, it may cover that for you, or a Medicare Advantage plan, it may be covered at a different rate than the standard Medicare 20%. Number 7 is mental health, and this is good news because Medicare recently started covering mental health services and treatments. It's wonderful that Medicare is finally covering some mental health because the impact of mental health is real, especially for someone who maybe lived their whole life surrounded by people and their love of their family and their spouse, and perhaps those people are gone. And so a lot of times on Medicare, we find that individuals are struggling with mental health and with loneliness and some other things like that. So it's wonderful that Medicare has realized this as well. So what does Medicare cover? Medicare covers things like marriage and family therapists, partial hospitalization, and services like psychiatric care, counseling, and therapy. In addition to that, Medicare Part A also covers inpatient mental health care with some restrictions on length of time for people who need to be actually hospitalized for mental health. Now, the costs depend on the type of services that we're talking about. So if your doctor or the healthcare provider accepts Medicare payment terms, then you won't have to pay anything out of pocket for your annual depression screenings. After you meet your Part B deductible, then you pay 20% of the Medicare approved amount for visits to healthcare providers or to diagnose or to treat conditions. Or lastly, if you have to be admitted to a psychiatric hospital, then you pay what is equivalent to your hospital rate for those stays. So the amount that you pay for these services varies. And of course, it also varies based on the type of insurance you have with your Medicare. Number 8 is therapeutic shoes and inserts. If you're struggling with foot problems, particularly for people with diabetes, then the following things can be really helpful and are actually covered by Medicare. So again, if you have diabetes or severe diabetes-related foot disease, you are covered for the following things every calendar year. 1 pair of custom molded shoes and inserts, 1 pair of extra depth shoes, 2 additional pairs of inserts each calendar year for custom molded shoes, and 3 pairs of inserts each year for extra depth shoes. So that's a lot of inserts. The cost is your Medicare Part B deductible and 20% coinsurance because it falls under Medicare Part B. If you have other insurance, then the cost could be different. But it's really important to take care of your feet. We oftentimes take them for granted, but without your feet, you lose your mobility. Number 9 is hospice care. And no one wants to think about needing hospice care, but if the time comes, Medicare can cover most of the costs instead of your loved ones having to take that on. Now, here's what's included in hospice care. Items and services like drugs, durable medical equipment, a plan for symptom management, and that includes medical nursing, social services. Social services is a big thing because in a situation where you know that you are going to pass and that it's inevitable, the counseling sometimes is needed for you and for your family. There are other things also like aid and even some light homemaker services and other things like spiritual and grief counseling. It's important to note, though, that Medicare only covers these things if you're terminally ill and that you've decided to focus on your comfort and quality of life rather than continuing treatments to attempt to cure your illness. And in some cases, unfortunately, it's not a choice. Sometimes there is no cure or there is no way that you can be treated, and that's when hospice comes in. There is no cost for hospice care from Medicare-approved providers. For the medications like prescriptions and things, there could be a copayment of $5 for prescriptions in an outpatient setting, and you may pay up to 5% for Medicare-approved amount for inpatient respite care. But here's an important thing to understand. Hospice care is not the same as long-term care. So Medicare is not covering long-term care. If you need a place to live because you're in a hospice situation, Medicare can't cover the room and board. That's long-term care. But it will cover the care that you receive for that end-of-life treatment. Number 10 is hearing exams. Now I have to admit, sometimes I hear my wife say, "Hey babe, why don't you just relax on the couch?" When she says she told me to take out the trash. Now, I don't know if Medicare can fix that kind of hearing issue, but I know what Medicare can do. It can diagnose hearing and balance issues if your Medicare enrolled doctor or healthcare professional orders them to find out if you need medical treatment. So when we talk about hearing exams, it has to fall in the realm of medical treatment, not just issues in hearing. And this is one of my big beefs with Medicare. I feel like not being able to hear has a massive impact on your health. But unfortunately, Medicare's not covering that. But they are covering if we need to find out that your hearing is related to inability to balance, etc., and risk of fall. If your Medicare enrolled doctor or healthcare provider orders them to find out if you need medical treatment. Now, in addition to that, you can visit an audiologist once every 12 months to do an exam for non-acute hearing conditions, meaning you didn't lose your hearing suddenly, you've been gradually losing your hearing. You can get that exam every 12 months. Unfortunately, they cannot help you with the hearing aid unless you have other insurance that covers hearing aids. So I want to stress here, this does not mean that Medicare covers all hearing exams, and it certainly does not cover hearing aids. But for these few things that it does cover, the cost, it's under your Medicare Part B, so again, it's the same thing, your Part B deductible, 20% coinsurance. But if you need help with hearing, or you want to do hearing exams or hearing aids, the best place in Medicare to get those things is from a Medicare Advantage plan. Number 11 is eyeglasses. Now, unfortunately, Medicare does not typically cover eyeglasses. And it's one of my beefs with Medicare. Medicare doesn't do much for your eyes, but one exception to the eyeglass rule for Medicare is that after you have cataract surgery, Medicare will pay for one pair of glasses with standard frames, and that's about it. The cost for that is your Medicare Part B deductible and 20% coinsurance. Just like everything else that I've gone down this list, it's under Part B. Fortunately, many Medicare plans on the Medicare Advantage side cover a lot more stuff for eyeglasses, but if you have a Medicare supplement, then this is all the coverage that you have. An interesting side note here, when you have cataract surgery, Medicare only covers the standard lens. Most people want this new lens. I say new, it's been out for like 10, 12 years, and Medicare does not cover that. So to get the new lens when you have cataract surgery, you have to pay for the lens yourself, even though Medicare is going to cover for the rest of the surgery. All right, number 12, your wellness visit. This one is for everyone. A yearly checkup might not seem like a big deal, but it can make all the difference to your long-term health. That's why Medicare covers a Welcome to Medicare preventive screening. Welcome to Medicare is the name of it, and that is only in your first year of Medicare. And then they cover an annual wellness visit every following year. An annual wellness visit, by the way, is not the same as a routine physical exam. Medicare does not cover a routine physical. So I'm going to explain the difference between an annual wellness visit and a routine physical exam. A routine physical exam, it has no specific purpose, it's just a checkup every year, and it has blood work. You know, you think about going to a routine physical, they're going to probably send you to Quest or somewhere to draw blood, and they're going to do a whole lipid panel and everything like that. With an annual wellness visit, it's done to develop a personal preventive plan and to do a risk assessment of where you're at in your health. It does not include blood work. Blood work will only be paid for by Medicare if it's to diagnose something. So if the doctor is ordering blood work to diagnose something because they have determined that you have some symptoms and they need to know why, now that will be covered under blood work, but it's not going to be covered under the annual wellness visit. Now, the annual wellness visit, as well as the Welcome to Medicare physical, don't have any costs or copays associated with them. They're actually free with Medicare. But if the doctor determines from that visit, like the annual wellness visit, that they need to order blood work, now you may have a copay for your blood work or for the tests that need to be done. Now, if you want to learn more about what Medicare covers, Medicare itself from the government has an app called the Medicare What's Covered app. You can download it on the App Store, whichever app store, the Google Play Store, the iOS App Store, and You can use it to search or to discover what things are covered by Medicare. In addition to that, there are some surprising things that Medicare does not cover. And I made a whole video about that you can watch at the end of this video right over here.